A very good evening to all of you. Myself, Dr. Prateek Garg. So today we will discuss about OAE, that is auto-acoustic emissions. That means certain sound stimulus or emissions which are being produced by our ear. Auto means ear, acoustic means sound, and emissions means the emission of the sound energy. So autoacoustic emissions are a certain type of sound energy which is being produced by outer hair cell. So we all know in the inner ear there lies the basilar membrane, and over this basilar membrane there lies the organ of corti, which consists of outer hair cell and inner hair cell. Inner hair cell are generally in one row, or we can say single row, and outer hair cell are they are in multiple number and in multiple rows. So outer hair cell, these are producing certain acoustic emissions which are known as autoacoustic emissions. So what is the baseline of this OAE study? So these are to check the pathology or the normal condition of outer hair cell. So by means of autoacoustic emissions, we can detect whether the inner ear or the organ of corti is functioning normally or there is a disease of inner ear. So how does this OAE testing be done? So it is generally a screening test in newborn babies. Screening test of hearing. Important examination point. So in OAE, a probe is placed inside the baby ear canal. That is the external auditory canal, and these autoacoustic emissions which are being produced by normal outer hair cells are being recorded by this probe, and through the machines these are detected. So it is an useful screening test for hearing, to check the hearing in the newborn babies. So what is the important points? Firstly, this is an objective test. Objective test, what do you mean by objective test? That means the machine itself is recording these autoacoustic emissions and detecting whether they are present or not. So they are not biased according to subject thinking. That means it is totally machine dependent, so patient can't lie about them. So it is not dependent on patient's response. Okay, so it is an objective test where the machine itself detects the autoacoustic emissions being produced from outer hair cell. So the biological activity of outer hair cell, this will lead to generation of certain sound energy which are known as autoacoustic emission, and to record them correctly, the middle ear should be normal, the external ear should be free from any type of wax or any type of debris. So this is a prerequisite for OAE. Now OAE are of two types. The first one is spontaneous and the second one is evoked. So what do you mean by spontaneous OAE? So spontaneous means in 50% of the population, the outer hair cell are without any stimulus, they are producing these autoacoustic emissions. So spontaneous OAE means we have to just grab these spontaneously generated autoacoustic emissions, and they are being taken and read by that machine. So spontaneous OAE, it doesn't require any external stimulus. It is the spontaneous activity, a spontaneous generation of sound energy by the outer hair cell, and that is being recorded and studied in the OAE machine. So this is spontaneous OAE. Now comes the evoked OAE. Suppose we have to know about the pathology of the inner ear, or we have to check how the outer hair cell are working and in what amount they are working. So what we will do, we will give the evoked OAE. We will just give certain type of sound stimulus, certain stimulus to the outer hair cell, and in response to that stimulus they will produce the sound energy, and that sound energy is being grabbed and studied by the autoacoustic emissions machine. So evoked OAs are produced in response to sound stimulus. These stimulus can be click stimuli, click or burst stimuli. Click stimuli, that means it consists of multiple sound of multiple frequency. We can say tone burst. And evoked OAs, it is also known as camp echoes, K-E-M-P echoes. So again, evoked OAs of two types. The first one is transient and second one is distortion product OAE, evoked OAE. So let's study about transient evoked OAE. In transient evoked OAE, the stimulus, the difference of stimulus is there. In transient evoked OAE, we will give a transient sound, and the sound is consistent of click sound or tone pip. That means a sound consists of multiple frequency, and whenever the stimulus is given, the response is being obtained and studied. So the difference in transient and distortion product is, here we give the click sound, which is a mixture of multiple frequency, so it will stimulate a large area of cochlea. See, we all know, suppose this is our cochlea. So cochlea like this. So the cochlea consists of basal tongue and apical tongue. Apical tongue is responsible for lower frequency. So lower frequency sound is perceived by the apical tongues. The basal tongue perceive the higher frequency. In presbycusis or age-related, higher frequency sound are more affected as compared to lower frequency. So suppose this is our cochlea, different tones in the cochlea responsible for different frequency of sounds. Like the basal cochlea will read about higher frequency, like suppose 20,000 Hertz. Then comes 18,000 Hertz. Then comes 15,000 Hertz. And suppose apical tone, suppose this is a complete cochlea, and here comes the, if we unfold the cochlea, the tones are unformed and made into a straight line. So suppose this is the apical tone and this is the basal tone. So basal tone, they will perceive the higher frequency like the 20,000 Hertz, 15,000 Hertz. And the apical tone, they will study the lower frequency like 250 Hertz, 500 Hertz. So in transient evoked OAE, click sound, a sound consists of multiple frequencies given, so that will stimulate complete cochlea. So different frequencies, it will stimulate complete cochlea, and the response is being obtained and studied. So we can have a particular idea about complete cochlea, because in all around the cochlea outer hair cells are produced. So whenever we are stimulating the complete cochlea by a click sound, so outer hair cell from all the particular areas of the cochlea will produce the photoacoustic emission, and that are being studied. So we can have a complete idea how this the cochlea is functioning, whether it is normal functioning or some pathology is there. Now there comes the distortion product OAE. In distortion product OAE, what we will give? We will give the tone of specific frequencies. Suppose this is my cochlear tone, which I have already unfolded. I mean, suppose these were the round of the cochlear tone, so I have unfolded and made a straight line. So this is the basal tone and this is the apical tone. So apical tone, here will be the lower frequency like 125, 250. In basal tone, higher frequency like the 20,000 Hertz, 15,000 Hertz, like this. Okay. So in distortion product, we will give a tone of specific frequency. Suppose we are giving a tone of 5,000 Hertz. So this 5,000 Hertz tone will stimulate only this area of cochlea. So we will get an idea about this particular area of cochlea, so that the area of the cochlea which is responsible for measuring or perceiving the 5,000 Hertz sound is functioning normally or not. So distortion product, we can have an idea whether the pathology is at the basal tone or at the apical tone or in the middle. So this is the difference. In the evoked OAE, what we are giving? We are giving a sound stimulus in form of either the click or tone burst or sound of particular frequency. So by that the OAE are generated and received, and from there we can study about the cochlear function or the functioning of organ of corti. So what are the uses of OAE? It is a best test for screening of neonates, hearing screening in neonates and children. So what is the best test to assess the hearing in neonate and children? If we ask the best test for hearing assessment in neonate, then it is BERA. But if examiner want to ask what is the best screening test, so screening test is OAE. And what are the other uses? To differentiate between cochlear and retrocochlear hearing loss, because OAE will tell about the cochlear pathology. So if any child is deaf and the OAE seems to be normal, that means we can predict that the cochlea is functioning normally. Whatever the pathology is, that is the retrocochlear, maybe at the level of the eighth nerve, maybe at the level of the brainstem. What are the other uses? It is also useful in early detection of noise-induced hearing loss. We all know in the noise-induced hearing loss, it did occur at 4000 Hz. So in distortion products OAE, we can detect or assess that particular area of cochlea. Okay, so useful in early detection of noise-induced hearing loss in the patient taking on ototoxic drug, etc.